We're just actually, because we were waiting for the technician to get the online system going, we were doing a case, which I think he is sending to you or has sent to you, case study 1, female age 42, it's a diarrhea case, it should be. Female age 42, staff, I guess that's her occupation, she's married. Chief complaint is diarrhea during menstruation. The history of the present illness, the patient's bowel movement move regularly except that during her menstrual period she suffers from loose or even watery bowel movements. Symptoms presented by the patient: thirst for drinking, urgent urination, insomnia or sleeping with many dreams, and a perceiving of heaviness, heavy sensation of the 2 legs comparable to lead. Recently, she's had profuse menstrual bleeding with blood clots. Okay. The tongue is red with a white coating, and the pulse is wiry and fine. I'll scroll down here so you can see here. Oops. There we go. Okay, so for those of you who are in class, I want you to trade your answer with somebody else. Okay? I know. Yeah, but see, this is the point. You need to understand somebody else has to interpret what you wrote. And so by you, did you trade? Okay. And now you trade with, yeah, trade. Yeah, see? There, okay. Okay. Did you trade? You guys trade? Trade. Trade your answer. Even if you're not finished, trade your answer with the other person, because I want you to understand I want you to understand what somebody who's marking your exam is going to be going through. All right? This is what we're going to do, especially in the last day. We're going to do this every case, yeah, because you need to see what the answer is and try and understand how challenging it can be to mark somebody's diagnosis and treatment plan. Okay. Okay. Everybody here, everybody that is in class, for those of you who are online, is trying to explain their written answers to this case to their partner. So just give them a second to continue this, and then we will go into the office and check it out. Okay. All right. Can you guys, so now that you finished explaining it, can I get everybody's attention back here for a minute? And then that way we can move forward. So, you know, again, what I want you to do is I want you to just, you know, you don't have to actually mark it this time. And the last day, well, I'm going to have you grade it so that you can understand. So one of the questions is, did they answer all the sections? Did they actually write down an illness? Right? Did they write down a pattern? Each of these sections is worth points. Okay, so let's look at this. Look at the answers to this case. All right. So what is the TCM diagnosis? Instead of me going through it, because these aren't actually my cases. These were made by somebody else. So I'm showing you the actual answer. So you're grading based on what I'm doing as well, right? So if I was marking the exam, I'd be reading, this is the correct answer, and I have some understanding, and then I'm looking, did they cover everything or not? Did they change a few points? Did they have a reason for did they write the same diagnosis but in a different way, or did they miss a major part of the diagnosis? So what's the answer here? Make it bigger. Yes, I can. How's that? Okay. So what is the actual diagnosis? Well, obviously it's diarrhea. And then he gets a little bit more specific. He says this is menstrual diarrhea, but that shouldn't be difficult for anybody, right? At least identifying that this is diarrhea. How about the diagnosis? The syndrome differentiation. Now look at this wording. This isn't out of the textbook, is it? It's a little bit more complicated. Yin deficiency bringing heat, heat tangling with water, disorder of metabolism, and water and fluid flowing downward in the large intestine, resulting in diarrhea. So this is the person, these are his cases, and these are the actual answers to, I don't know what this is, a little pop-up here, what the answers to his cases are. So what am I looking for? I'm looking to make sure that you have yin deficiency with heat, and that's the main pattern here. And with dampness flowing downward or something like this, some form of dampness. Okay. How many people had something that was similar to those three? How many people had yin deficiency? Everybody saw yin deficiency? You just said spleen deficiency. Alex, I don't know what's going on here, but you have like pop-ups coming on and winning prizes and stuff online. Yeah, I'm not sure what that is. Liver chi attacking spleen. You put liver chi stagnation as well. Okay. So now let's hang on a second. So I'm just going to go down and I'm going to read through more information here. So reason for the diagnosis, there is a component of liver overacting on spleen, isn't there? Okay. So regardless of the wording, I have to take that into account. This is a case of so let me look at it this way. If you said, what was your diagnosis? Give me an example. Yeah, what did you write? What was your actual diagnosis pattern? Yeah, what was the pattern? Liver chi attacking spleen with a kidney yin deficiency. So, and this is because so if I go back, I'm scrolling back to the actual signs and symptoms here. So, yeah, reasons. Why kidney yin deficiency? Okay. Because insomnia and sleeping with dreams. Thirst for drink. Urgent urination is because of what? Heat? Really, you think? In the bladder? Bladder heat, urgent urination. Well, urgent urination is interesting. I would have, based on your diagnosis, normally the only thing that would cause that would be damp heat in the urinary bladder, wouldn't it? I mean, normally if we just have, you know, so I would, in your case, I would have classified that under the kidney deficiency rather than the heat causing that. But go ahead. That's also heat. And then the red tongue is heat. Yeah. Um, okay. Anybody have other? So spleen deficiency is causing heaviness of the legs? Okay. See how complicated this actually might be? All right. So, all right. Let's look. So let's look at this again. Rather than dwelling on any one part of the case, okay. Rather than dwelling on any one part of the case, what was your treatment principle? Right? What did you do? So if you say, kidney yin deficiency, liver overacting on spleen, right? And what? And heat. Heat where? Liver, maybe? Yeah, it's hard to say because there's no real symptoms anywhere, is there? I mean, you don't, liver qi can easily generate heat. This means that my treatment plan is going to be to nourish kidney, yin, soothe, liver, tonify, spleen, clear, heat. Okay. This is interesting. Yeah. Yeah. Well, yeah, so it doesn't say that they're purple, and it doesn't say the menstruation is painful. Liver qi stagnation could be causing the blood clot. So, um, if I'm wondering if there's actually herbs here. Yeah, there is herbs here. So, uh, if we scroll down, let's skip the entire, I'm going to skip the acupuncture prescription and come back. Remember, what is the condition that you're treating, right? What's the illness here? Is the diarrhea. So even though this might be the whole picture of the case, what is the emphasis in this case? The emphasis is actually on the spleen weakness being the cause of the diarrhea, right? Right. So what is a mechanism of yin deficiency here? No, the mechanism. It's a 42-year-old female and with diarrhea. So it doesn't say how long that they've been having it, but we do know that diarrhea can weaken yin, and we do know that there may be some mild yin deficiencies at as we get closer to that age, right? So, and the chief complaint is in fact what? Diarrhea. So the caution is if you focus on nourishing yin, you're actually going to generally a lot of the yin tonics, Shu Di Huang, for example, is bad for diarrhea. Generally, it can be contraindicated. It causes the stools to be looser, as a lot of the yin and blood tonics are heavy and cloying and difficult to digest. So I think one of the things about this case that's interesting is that the treatment, if we go back to the treatment now, focuses on, well, where is it? Uh, focuses on, for herbs, let's go to the herbs specifically, and then we'll go back to the points. So the herbs specifically, we use modified Tongxie Yaofeng, okay, which is basically primarily spleen tonics, a little bit of dampness, right, and soothing liver. I mean, this is a liver and spleen disharmony, okay? In terms of, out of this book, which pattern is most closest to this? Well, it's liver spleen disharmony is mostly what we end up treating. So despite the fact that two things, one, there is yin deficiency, and that is part of the diagnosis, and despite the fact that he words his answer in a very strange way, which basically, also includes dampness. Remember, he talked about dampness as being part of this pathology. Well, it is a form of dampness related to spleen deficiency. That is actually, according to him, that is the mechanism of the diarrhea here, right? That's the cause of it, is the weakness of spleen, which is not transforming or not, it's aggravating. And the root of that is in the liver. So it's not entirely clear whether the heat signs are because of the liver stagnation or because of yin deficiency here. We don't really know for sure because we have some signs of both and we have these signs of heat. It's hard to say. But if we actually look at the prescription, if we look at this prescription, sorry, I'll erase that, we can see the treatment, that we can in some cases see the diagnosis more clearly. So what I'm saying, the point that I'm getting at is if you focus on tying your entire case together, meaning don't worry so much about how you word the diagnosis, because not that you shouldn't pay attention to that, but what is your actual treatment method is what's most important here. How many of you in your treatment method chose to soothe liver, tonify spleen, and, in this case, even astringe the bowels a little bit, right? And I would be looking for something similar to that, right? What's a little strange about this case is that this formula is mostly used for painful diarrhea, isn't it? Right? Yeah, with more liver. So there's not a lot of liver stagnation, but it is asking you, it's saying, well, which one is most appropriate in this case? If you know the single herbs within the formula, so if using this as a base as opposed to, Shenling Baijusan or something like this, which is for spleen deficient diarrhea, then you can choose this formula. How many of you are feeling confident? Let's go back to the points. Complicated. You think it's complicated? Okay. All right, so going, for those of you who are not doing herbs, in some ways it's a little bit simpler, again, because the diagnostic criteria can change a little bit. So for acupuncture, what is he using? So, yeah, so of course, diarrhea, front mu point of the large intestine, is empirical. Stomach 37, the lower Hesi point of the large intestine. Okay? Spleen 9, dampness. Heaviness of the legs, diarrhea. What's weird to me is that we don't see much dampness in the tongue and pulse, right? We mostly just see the liver stagnation in the tongue and pulse. but that's because the yin deficiency masks that, okay? Ren 9, shui fen, water separation, right? Ren 9, just above the navel, is commonly used for this type of spleen deficient diarrhea, okay? This point is strange to me. I mean, I wouldn't normally choose stomach 44 in this case. It does clear heat from the stomach, but you know, I don't, even though I do see the internal heat, I don't see a specific reason to clear it from the stomach beyond the thirst. Stomach 36, empirical point for abdominal symptoms, right? Diarrhea is an abdominal symptom. We have weakness that's also tonifying. We do have weakness of the spleen and stomach. And then gongsun, okay, which is spleen for the not only nourishing spleen, but it opens the chongmai. So chongmai, what is chongmai? See, you know, chongmai regulates not just menstruation, but chongmai regulates menstruation, and it regulates, how to say, rebellious qi. So we use it a lot for treating like nausea, and in this case, diarrhea is also a form of rebellious qi. Notice he adds Ren 8, moxa to Ren 8 as well is appropriate in this case. And then the treatment protocol is 3 to 4 times per week and then reassess. All right. I would say in this case, I would say it's a lot. But I would say it's not practical for Canada generally. So 2 to 3 times per week is, you know, that's kind of usually the higher end of, yeah. 2 times might be more reasonable. You know, keep in mind, don't scale back too far. I mean, write down what you want them to do, not what your patients usually do, right? That's maybe important to understand. What is good for them? What is appropriate? I mean, you know, the reality is that like you can also write an explanation if you wanted to. So for example, I might ensure that they're coming in this case. You know, how can you reassess when they don't have the symptoms? So in this case, it's tricky because if you're treating them mid-cycle, mid-menstrual cycle, they're not going to have symptoms. So how do you reassess? Is it improving? Is it not? Well, I can check the tongue and pulse and see if I create changes there, but I'm not actually going to be able to notice the changes in symptoms. So exactly. So the important point for this type of a treatment, you want them to come before the week before menstruation, or you know, starting from you know, day 14 or whatever through, right? So isn't that interesting? Yeah, there's no points chosen from the liver here. Liver 3, yeah. Mhm. So you chose liver points. Mhm. Yeah. So yeah, I don't see why you would not add a liver point here. You know, you could, but you know, you probably don't. So that what is probably more important is addressing the symptom, the acute symptom, which in this case is a diarrhea, and then the cause of the diarrhea is actually the spleen weakness, and then the cause of the spleen weakness is the liver. So, you know, acupuncture, because its effect is very short-term and immediate, if you want to improve the diarrhea, this is why we, you know, choose these points first, and then from my perspective, I think you should also have at least one liver point, liver 3 or something, if that's your diagnosis, and based on the tongue and the pulse. Test. Right? You know that there's not. Yeah. You have to analyze. Hello? Check, check. Yeah. What's the main pattern? Okay. Okay, so what's that? Yeah. That's spleen deficiency. Yeah. Okay. What's the next case? Oh, sorry, we didn't really talk about herbs for that one. What formula? Huangqi Jianzhong, okay, or Li Zhongwan, yeah, something like that. If you're just doing acupuncture, no, then you should not write herbs. What was the next case? 18.3? We didn't do that one before? We did that one. We did 18.4, but not 18.3? Okay. Okay. Read 18 points if you did it. Is 18.3, what is the main pattern? What is the most appropriate pattern for 18.3? Good, correct. Stomach and spleen qi deficiency. If you said yang deficiency, it is incorrect. It's weak on the right side. It is not deep. That's right. That's right. Yeah, mostly qi deficiency here. Your treatment principle would be to tonify spleen qi and stop diarrhea, right? One of the questions here, now I will bring up, this is one of the questions that may come up is there pathogenic dampness in this case? Is this excess dampness or spleen deficiency or a combination of the two? So because the head is muzzy and the tongue is swollen, we may be inclined to say, well, there's some dampness present here too. However, because the tongue coating is not thick and the pulse is not slippery, right? We would be inclined to say whatever dampness is shown by the muzziness of the head and the swollen tongue, that's due to the spleen deficiency and not, you know, not due to damp accumulation, right? That's the only other little possible point of confusion maybe, right, that somebody might have here. Not so much between qi and yang deficiency, but between excess and deficiency. Is this qi deficiency or excess dampness? Well, again, the cause of the diarrhea is this qi deficiency. The dampness is whatever dampness there is a result of that qi deficiency, and it's primarily deficient, not excess. Treatment principle is going to be to tonify spleen qi and stop diarrhea. Okay, Shenling Baiju is fine. Clear? Any questions on that case? Points, diarrhea, stomach 25, UB, stomach 36, Ren 6, Qi high, yeah, CV6. UB20, Pishu, spleen 3. That's correct. That's perfect right there as far as I'm concerned. Okay, that's the idea. Is you do enough of these, you start to get at least a simple. It feels good, right? Okay. What was the next case? That's right. What's the next case? 19.2. I thought we did this. You did that one. 19.4. 21. Did we do 20.1? We did. Okay. 21.2. I think we did 20.1. I think we did that one. We did not discuss. Okay. All right. Okay. 20.1. A 30-year-old woman had been suffering from what had been diagnosed as recurring cystitis. So, how many of you know what this is? And how many of you don't know what it is? Don't be shy. The question is, if you don't know, you could be expected to know what signs and symptoms would occur with cystitis. What does that indicate? This is also a lesson because you're doing the PLAR. Remember, you are allowed to have textbooks, so bring a good dictionary, right? Bring a dictionary that has, these TCM reference textbooks don't always have an easy way to look up a term that you don't know. So have a printed, I know you guys are going to roll in there with like this many books now, right? And that may be too confusing, yeah, but I would say that a good dictionary that has a lot of these terms is probably very, very important for you if language is a challenge. An English speaker that. Well, I don't. Any of the Chinese terms. So any of the Chinese terms. For Western, I'm not quite sure. You mean for Western medicine, like terms? Yeah, in the Chinese language. But for me, anything that, because the exam is in English, so they'll always have a translation if it's not a major common term, right? So if it's just qi, talking about jing qi or something, using terms like this, we don't need a translation. And even like Yangming or any of this, I know all of the common terms, so I wouldn't bring a dictionary if it was me. For Chinese language, I would still want a dictionary, just a English language or medical reference, like something that's concise but has most terms in it. Yeah. Yeah, we learn in English, and then a lot of my teachers speak Chinese, and I spent time in China, so the Chinese language was there too. But the actual education, but my first education was in English, so it made it easier for me to grasp it all. Yeah. But for sure, mostly I use like a digital resource because I can, if I need to look something up in Chinese language, is very difficult, right? I don't have a specific suggestion for the dictionary. It depends on what your needs are. So if it's English language that you really have a challenge with versus medical terminology, there's probably a medical terminology to Chinese language. I don't know of one though offhand, but I might look up one of those. Oxford English Dictionary is a standard. That's just a standard English. It should be, yeah. Most of the medical terms are in there too. Yeah. shouldn't be that tricky. Yeah. Yeah. That's correct. Right. That's right. Yeah. It is very confusing. It's very challenging learning Chinese medicine in English language because there's many different translations. So when you see a case or when you're writing your diagnosis, remember that the college has helped by publishing standard translations. WHO also, right? WHO has the standard terminology book. Right? It's thin, it's small, but you could certainly, you'd have to get it bound, I guess, to bring it in. But you know, you can still the WHO version is online. Yeah. Sorry for those of you who are at home, but I'm just going to do a little quick side. The college publishes the terminology, standardized terminology, but there. Okay. So don't. Okay. All right. So case 20.1. What is the diagnosis? Who did this case? Who completed it? All right, what's your diagnosis here? So this is okay, and so is this the illness or the pattern? The illness. So heat. What do you mean by what's the Chinese term here for urination syndrome? Lin syndrome, right? Yeah. Yeah. So heat Lin is, and some people don't quite grasp this. This is a an illness. Lin syndrome is painful urination, right? Heat Lin is actually a diagnosis. I mean, heat Lin is actually a pattern as well, isn't it? Yeah. So what do you have anything else for the pattern here? Good. Okay. Does anybody? I mean, this is there's a little bit of an explanation here. So you know, if I just said painful urination, so I'll give another example. This would also be acceptable. Lin syndrome, which is painful urination caused by heart fire. That's a simpler way of writing this. You don't necessarily, you know, this is the when we treat Daochussan, and we're treating, this is heat Lin, right? I mean, we don't necessarily have to write much more than that if we don't want to. If you can identify that pattern, that's good. Okay. So does anybody have something different or disagree or have a question about the pattern? Everybody's clear on that? So then what's your treatment principle? I like that. I like that. Anybody have questions on that? A few things that I really like about this is that she's explaining everything and she's treating everything that's present, right? You're treating the root, which is the heart fire here. You're also saying that you know, are you going to use some herbs that clear from the urinary bladder? Yes. So even if I wrote heart fire as the cause, if I look it up again in a Zongfu textbook, we will see that heart fire right? If you look up UTIs or urinary tract infections, we have major differentiation: damp heat in the urinary bladder, heart fire. You know, I don't necessarily have to write all this out, but you can. It's not going to hurt to explain you understand the mechanism here. But in the treatment principle, I am going to address the urinary bladder. Do I use, you know, REN3, the front move point of the urinary bladder? Do I use herbs here that will go to the urinary bladder and clear some heat? Probably. Is there Shen agitation along with this pattern? These are other issues that are arising with this pattern, right? Besides the illness, which is the painful urination, we have Shen disturbance and the chief illness, right? Anybody have comments, questions? I like that. Sorry, repeat the question. If the patient has bleeding Lynn syndrome, which formula is better? Sorry, I'm not. I don't have. I don't have one on the tip of my tongue right now. That's sorry. I still had that. I mean, Daltrason is kind of a basic formula for this type of a condition. It doesn't really treat the bleeding, so you can modify that. If there is, so actually, here's a question now. Let's ask a question about this case. Is there damp heat in the urinary bladder? Why does the root of the tongue have a yellow coating? I'm willing to bet that there is a slight amount of damp heat because of that tongue coating. You know, yeah, the root had a yellow coating on with red spots. Yeah, but because it's at the root of the tongue. Okay, I don't have the textbook with the answers, but we'll have to check that. We'll have to check that a little bit. You know, saying that there's just heat, you know, yeah, a little greasy, a little slippery pulse. It's still the fact that there's frequent scanty burning urination with a yellow coating at the root and a wiry pulse in the position makes me think, well, it's possible that there's a little bit of damp heat. The problem is that it's certainly you have the main pattern, the most important pattern. Is there some damp heat? Possibly. If you wrote damp heat in the urinary bladder, that would be incorrect. You would have missed the main point, main pattern. You assume that if they have blood in the urine, why? I know it's a different case. Yes, it's not. We don't need to think about that now. Don't make it more complicated than it is. The reason is I mean, you know, if there are like you could add herbs specifically to stop bleeding if you needed to, but I'm not sure. I don't want to think about it in that way. Hang on a second. You guys get it set up yet? Okay. Okay. How to use it. Okay. Let's see. Where's volume 2? There it is. Let's instead use this as an exercise to look at, what is this, volume 2? Lynn syndrome, volume 2. I'm not I'm just looking at the table of contents here. Edema. Oh, we don't even have urinary retention. Okay, yeah, I'm looking at urinary retention. You know, this is, even though it's not quite the same, we still have the similar patterns, right? You know, if I had to use this textbook here, and then I'm looking at damp heat, stagnant liver chi, blood stasis, chi deficiency, kidney deficiency, something like that. I mean, I guess this is not really a great example, but yeah, I mean, damp heat would end up being the most appropriate here, but it doesn't really address the heart fire at all, which is not helpful. Okay, well, okay, so what was your treatment plan? So what points did you use for this case? Let's stay with yours, since you did the diagnosis and treatment. What was your actual treatment plan? What points did you use? Yep. Yep. Good. Okay. Uh-huh. Sanjiao Shu is 22. Okay. Liver 2. Why liver 2? So I can explain why you would use it, and it's because of the meridian, right? I mean, the liver meridian goes to so if we have painful urination syndrome, we often use liver 2, but you should kind of know why you're using it if you do add it, because you don't diagnose or address liver heat anywhere else. So, but I think that that's pretty good. Anybody have something else that they would like to add? Spleen 6 and 9. Yeah, we often use spleen 6 and 9 for Lynn syndrome, don't we? Right? You know, even though we aren't treating damp heat, I may still add one of these because we really see it almost empirical with painful urination. You know, we almost see that as a spleen 9 especially as like, you know, anytime we have painful urination, we see that. Like if it, you know, there's a textbook which is single point therapy. So what is the single most important acupuncture point for painful urination, it's almost never local, right? It's almost never the mu point or shu point. It's almost always the, like, and we usually would see spleen 9 or one of these yin meridian leg points simply because that's where we see the manifestation. You wouldn't use the upper body points here. So, you know, regardless of the cause or the root in this case being the heart, yeah, you should address the heart, but I would say that I would add spleen 9. Yeah. And you'll probably see that in most of the textbooks as well if when you're treating the Lin syndrome. And herbs, what formula? Yeah, Daochi-san. What's in that? What's in that? Okay. That's what Daochi-san is. I'm just not familiar with what the difference between Daochi-san and Daochi-Xie is. Yeah, but so does Daochi-san. I mean, it's mild, but okay. Dao Chi Xie, Qing Xin, clear heart, right? Gotcha. Let's check it out. So, it's not really coming up as a separate, formula in most of the major. I'm not sure this will actually list it or not. I'm not. Is it the same formula? Or is it different? A little bit different. It's probably fine. Here, yeah. So this is fine. This is a good formula. This is good. Yeah. Right. Yeah. So this has is actually more appropriate, but I don't think this is this is a Wenbing formula. But anyways, we don't want to dwell on this too much. Let's just take a quick look at the comparison here. Okay, so yeah, basically we're just adding what's that? Some huashi, some mutong. Yeah, so it's kind of a combination, to be quite honest, of like Bajin-san and Daochi-san, right? That's basically what it looks like. Some of these little bits of it, anyways. But it's also a little bit more yin nourishing. Like, you know, like Maimen Dong is in there to nourish, Shengdi is in there to nourish the yin. Okay. Anyways, I think either formula is fine in this case. Daochi-san is pretty small. Next case, we got to move on so that we can get to the content for today. Next case is 21.2, is that correct? Enuresis, did we do this one yet? Not yet. 21.2. 21.2, nocturnal enuresis. An 11-year-old boy immediately, what should you be thinking right now? What should you be thinking immediately? Dosage of medicine, absolutely, if you're giving herbs. Oh yeah, child, okay? What else should you be thinking about? No. Think about jurisprudence. Think about legal issues with children. What should you be thinking about? Consent and issues with parental consent, consent for treatment. I mean, these are, two big major things that, you need to consider. They may not be addressing them, so it may not be addressing them in, this one doesn't say anything about the consent, but in my treatment, so remember, we haven't talked about it for most of these past cases, the treatment considerations, the diet recommendations we should include. Causes, diet, what are the things that might be agitating? If the case we talked about, the Shen problem related to the death of the father, I think it was, with the heart fire, what might we recommend the patient to help deal with that? I would recommend grief counseling. I would ask or inquire. I'd say, have you been to counseling, so to talk about this, or if somebody has an addiction, recommend that they see somebody that specializes in addiction withdrawal, or if they have, depending on what it is, if it's stress and anxiety, that they do meditation and qigong, if it's that they they always feel cold, that they dress warmly, and all of these TCM theories. This is all Su Wen, right? Think about Su Wen, Huangdi Ni Jing, Su Wen content, right? Su Wen. So, in the remarks, don't forget to add that. Sometimes I'm brushing over. In this case, because it's a child, even though it doesn't say anything about the parent or consent, I may add into the treatment considerations that I would, I may add into that I would request, that the parent also be present with treatment or something of that nature, right? I mean, that's normally what we do. This is 11 years old, so it's a discussion. It's not something that they have to be present, but it's a safety mechanism for us as a practitioner. Well, there's a witness there, so I didn't, we know that there's somebody else in the room at all times, and if he gets uncomfortable, it's fine. But make sure that the parent is at least close by, within hearing range, and if the child wants them present, something of that nature. Consent issues need to be considered, even though there's no issue. Okay, what is the illness? Bedwetting, right? Enuresis. And what is the pattern? What's the diagnosis here? Liver and heart fire. Basically, liver and heart fire. Anybody have something different? Did you do these? If you didn't try these on your own already, you're missing half the point. There's no use to come in and hear the answer told to you. The whole benefit is to practice and try it on your own first. If you haven't tried to write it on your own, then you're not actually you need to figure out what your strengths and weaknesses are. I mean, believe me, I've been teaching case studies for 10 years. There are books and books and books of case studies, let alone your own patients. There's an infinite amount of them. You never exhaust them. Every time you even go through the same case, it's new. It's a whole new process of, okay, what is the best diagnosis for this case? But you need to practice it, and the training is really, the conditioning of getting used to it is what's important here. So the reasons, why is this liver and heart fire? Okay? Yeah. Mm-hmm. Liver condition. Yeah. Remember with children and pediatrics, we learn that symptoms are often less pronounced, so we don't have as many symptoms in a child as we would have in an adult. Typically with a liver and heart fire, the adult may have a few more manifestations: hypochondriac pain, bitter taste in the mouth, etc., etc. Children are so young that their conditions. Not just that. Yeah, not just that the liver opens to the eyes, but wind. When a tick, twitching, yeah. A nervous tick is like a twitch. Not wind heat, because that's feng ru, right? Not wind heat. This means liver wind, yeah, and what gives rise to so the main pattern is still liver heat, but liver heat giving rise to wind is how we would explain the tick. The tick is the only sign of wind that we have, and it's not the chief complaint, which is the enuresis. But it is present. There is some liver wind we could add to that diagnosis. So, liver and heart heat with liver wind or stirring wind, something like that. Yeah, yeah. I mean, that it falls into that category. He doesn't have a high fever or anything, but it's not like some kind of infectious tetany or something where we have a high fever with convulsions. That is extreme heat causing wind, right? But it is, however, or that could even be like blood heat or something. It is still excess liver heat causing wind, stirring wind. Okay? So let's go. Yeah. So let's rewrite that. What is our diagnosis now? Who wants to tell somebody else now? Go ahead and reread that. What is your diagnosis now? What's your diagnosis for this case? I know. I'm asking you. We just answered it. So how would you? Because I want you to practice phrasing it. Right. That's what people have a hard time with, and that's where you easily miss something. So we know that there's liver heat. We know that there's heart heat. We know that there's internal wind. So how do you write that in a diagnosis, TCM diagnosis? Okay. So enuresis due to liver and heart fire. Okay. What's your treatment principle? Okay. And what? Stop enuresis. Okay. Anything else? Okay. So you could, okay, and then what is your treatment plan? So what points would you use to do this? Remember, it's a child, so don't use 20 points here. What main points? You have to reference. Okay. Anybody else? What points would you use? Uh-huh. Liver 2, liver 3, heart 7, yin tong, extra point, UB 28, spleen 6. Yeah, that's quite a lot. You may not need all of those, but anybody else? Something different? Want to add? Want to reduce? Spleen 9. Oh, okay. Yin Chuan. Yeah. So of these, I don't really think the spleen points are very necessary in this case. Because unlike Lynn syndrome, we don't need to stimulate this area locally because the mechanism is not the same. I also don't know if I would even use UB28. Possibly, but like not likely. Certainly liver 2, 3, heart 7, yin tong are good. And then actually what you would, even though there's no sign of kidney deficiency, we will often see that people will still address the kidney a little, either with urinary bladder 23 or kidney 3. And this is a yin-yang balance, and it's also, just like I said, empirical for Lynn syndrome might be spleen 9, even if there's not dampness present, like the last case. In some ways, the regulation of uncontrolled bladder, basically, we're still going to regulate the kidney a little bit. So I think that instead of those, I would probably use a kidney 3. Now, so one of the questions, going back to your, and it didn't really come up, but the other two questions that we do have did come up. So yin tong, what does yin tong do? It doesn't. No, it doesn't. It doesn't calm heart fire. It doesn't clear fire from the heart. What does it do? Simple. Calm the mind. Calm the mind. Calm the shen, right? Which is a product of the heart fire. So I guess the point being is that in your treatment principle, you may have wanted to add calm shen, right? So yeah, clear heat from the liver and heart, stop bedwetting, but you may have also wanted to calm the shen, calm the mind, right? Because you're using a point that doesn't clear heat from the heart, but does calm the mind. See how you try to make everything together. So what is the last thing here? I'm not 100% sure because we didn't do it in our treatment, but we may also, this is my question, settle wind, right? Or calm shen, calm wind, right? Or something like that. Calm wind, settle wind. So because there is liver wind, so it's a question of whether you're treating it or not. Well, maybe with acupuncture it's not that important because if I'm using liver 3, that does settle wind, right? I mean, it has that function. So, however, I guess my question is, think about your herbal prescription. Do you want to add longu, muli, or anything like this, to anchor down, settle the wind, right? Because often we would, if there's ticks and things like this. If you are going to do that, then you want to add this. If you don't think that you need to do that, then you don't have to. You probably, you may not get full points, but you're still addressing all the main patterns and the most important things in this case. The wind is the secondary symptom. If you're clearing the heat, it should get addressed. The question is whether you do it. And then, of course, with the dosage charts, we need to modify the dosage of whatever formulas, and you have to be very explicit about how many days do you prescribe this patient, right? How much do they take per day? Not just writing the prescription out. Remember, you can't just say X form. So what herbs did you use for this? Did you use herbs? Which formula? Longdan Xiegan. Okay. Okay. Lianzi Xing, Xin, X Xing, Lianzi Xing. Okay. For the heart, a little bit too, Huang Lian. So one of the challenges here, though, is that you didn't address the enuresis, so you didn't do anything specifically to stop the urination. So you may want to add what herb is major for Guijing, Jinsuo. Jinsuo. So that's a formula. Jinsuo. So this is the Jinsuo Gujing, right? Or but that's also not appropriate for the pattern, right? I mean, that's for doesn't clear the heat from the liver, right? You use both formulas together, okay? Or you use something like Sang Piao Xiao or something like this. Sang Piao Xiao. Sang Piao Xiao is like what's my pronunciation is not always great. Sang Piao Xiao San, even, but here it'll come up with the Chinese characters in a second. Here. No, this is it's just like it's empirically used for the urination problems as a symptom to address so I'm just saying I may add that because Longdan Shigan Tang, I guess you can't see that very well because I have writing all over the boards. Can you read that or not really? Oh, there we go. Can you read the Chinese characters there? So, I mean, this is for frequent urination, but not the whole formula. But look, it also has Longgu, calm the Shen. But Longgu is good in this case because it both anchors wind, right, calms the mind, it's cool in nature, and it helps astringe the urination. So I probably wouldn't use the entire formula. Certainly I wouldn't be giving him Renshen, but I may use some elements of this formula, along with the liver, or even, Longdan Shigantang is pretty extreme for a child. So I might be more inclined to use something like a modified, or like, well, I was going to say Danja Xiaoyao. We don't need spleen tonics. We can remove some of the spleen tonifying herbs, but like, Mudan Pi, Chai Hu, Bai Shao, it might not be strong enough. But whatever, even if you use Longdan Shigantang, small dose, make sure that you reduce the dosage, and more importantly, not more importantly, but along with that, the question is how many times per day, right? So if you write the full formula, but then you say take 3 times per day, that's not very clear. That's actually tripling the dosage. So if you write out the formula you want, and then you say, taken over 2, split into 2 doses per day or something like that, for how many days? How many days until you need to reassess? 3 days probably. Usually that's a standard, just a couple days here for a more acute condition. And make sure that the patient is responding to the herbs appropriately, that there's no unwanted side effects, And or maybe you use pills instead because the small pills are easier, but make sure that you dose it correctly. Okay. Sure. What? Say that a little louder. What do we do for the additional comments? So what would we? So, well, so under the question for those of you online, the question was, what do we do? What are the treatment considerations? So what is the additional considerations that we would do for this case since the child is very tense? Well, tense, yeah. So, but the question is, what is the treatment consideration? So I might inquire, I might ask about other emotional, like if the child has any other emotional disharmonies. You got to be a little careful in a situation like this because, well, there's no signs of abuse, but it could indicate, often with a child, it may be some kind of disharmony at home, like maybe they move, maybe their parents are having a hard time. There's probably something that is emotionally agitating the child, to be quite frank. So I guess you need to be a little bit careful about how you go about that discussion. Is it something that you have with the child separately from the parent because you want to ask them with the parent outside the room? Is it something that this is not really helping you, what I'm saying right now, because it's not answering your question? I wouldn't write all of this down, but I'm just saying my thought process. Or is it a conversation that I maybe have with the parents separately to ask, because sometimes children don't divulge much information themselves. But at any rate, you may want to inquire about any other emotional disturbances that could be, taking place and offer, this is maybe useful for a number of situations, offer to help find other healthcare providers that may address that situation, specialists. So we don't refer, but we should still oh, well, I can help you find somebody that specializes in childhood anxiety, or something of that nature. Yeah, to look into those options. Now that said, simply, the lifestyle recommendations would become ensuring that the child has a stress-free environment at home and at school. It could be bullying at school. It could be, it's hard to say because it's just so little information. But basically, whatever the parent is able to do to make sure the home environment is stress-free and the school or whatever else the child is doing environment is stress-free and safe. And well, sorry, say again? Well, not necessarily, because all children bedwet at birth. Right? It's not the same as like he had a pathology since birth. It just means he never really got over bedwetting, which in fairness, whatever that anxiety is from, yeah, it could indicate that it's from home, but it's hard. We don't have enough information to indicate that it is from home. All we can do is make the recommendation. Is there anything else that we could say? Well, don't eat foods that are aggravating heat in the body, deep fried foods, stuff like this. Yeah. Mhm. Mhm. Sure. I would say that that's good. I mean, this is part of treatment considerations. I would add maybe that in, or even in the acupuncture treatment. When I did pediatrics, 11 is, it's hard to say because all children are different. Yeah, 11 years old, you might be mature enough to, okay, I'm going to lie here for, but normally we don't need to leave the needles very long. But in pediatrics, if they're younger, then we do non-retaining. We just go in and out, right? We don't leave the needle in because of safety. Ear seeds would be good here, right? I mean, that might be an effective way to, prevent the, yeah, acupressure, we can use types of trina or gua sha to clear the heat as well, you know. But, I mean, even with the acupuncture, which we can use in this case, we may decide not to retain the needles or. Okay, so this is actually maybe what is the normal age that bedwetting stops? This is an interesting question. I mean, you have to know a little bit about pediatrics, right? Yeah, a little bit, but yeah, yeah. Um, I don't really want to get into the detailed questions about individual cases, but I don't think they would do that. But like in an exam, you may need to know something like that, which is what is. I don't think that they'll do that to you guys because they'd have to use an entire case for you to say no, that's normal. I'm not going to treat it. So I highly doubt that that would be the case. But theoretically, I mean, at 7, 7's kind of borderline. If it's every night still, if it's like a daily thing, that's, you know, most that might be a little bit late, but if it's a more occasional thing, then, that's maybe not too abnormal at that point. Yeah, especially with most, I don't know. I mean, I've treated children that are 11 that are younger than this, no problem, and they're very good. They lie there, they enjoy it. Usually the parent stays in the room with them, but that's not a problem, but you really do have to take each case individually. Yeah. And I've also treated kids that are so afraid of needles, so we just do Tuina. We don't do any acupuncture. No, 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 I don't want the needle. No, no, no. Or do you do cupping or something like this? So in this case, what would you do? You maybe do cupping on Ganshu, yeah, and Shinshu, and maybe some gua sha if you needed to clear some heat. Um, Uh, well, I mean, if they said in this, if I got this and it said they're 3 years old, okay, my response would be that the nocturnal enuresis is normal at that age, and um, but this child still has the same pattern, right, which is as indicated by the other signs and symptoms, and so we would still end up treating the same thing, but I would explain that but that I wouldn't worry about that. Yeah, I think that's overthinking it right now. All right, so next case. What do we do? We just have the two more, the last two. Okay, let's try and finish these up, and then we'll go for lunch. Maybe we can finish these in 30 minutes, and then go for lunch. Is that okay? Yeah. Okay. 52-year-old woman has been suffering from edema of the ankles for 2 years. She also suffered from early morning diarrhea, and she felt always cold. Her tongue was pale and wet. Her pulse was deep and weak. Pretty easy case. What is the diagnosis? Okay, here are the questions with this case. So everybody thinks less is easier, but sometimes it's trickier. The questions are, is it kidney or is it kidney and spleen? Is it yang deficiency or is it yang and qi deficiency? Is there or is there not dampness? I mean, these are really the three questions that we can ask. Now, if I was teaching diagnosis case studies, if I was teaching diagnosis to you guys, which I'm not, I'm not teaching the lecture on diagnosis, but if I was, I would make you analyze everything specifically, and I would, in order to, I'd say pick out, figure out what are the questions. Okay, now we need to be able to differentiate qi and yang deficiency. Now we need to be able to differentiate excess dampness from qi deficiency or whatever it is. So we have edema of the ankles specifically. Is there spleen involvement just because there's diarrhea? Right? Is there anything else that indicates spleen involvement here? Not really. Okay. Is there yang deficiency? For sure. There is, but is there also qi deficiency? So again, my question is there qi deficiency? Based on the number of signs and symptoms that they have, the weak pulse. So we have, again, we have very, very few signs and symptoms. So if you had to write these out on the board, we'd say, I'll use my little colored marker scheme thing here. We can say, so this is kidney, right? Is it specific qi or yang? It actually isn't specific. If it was pitting edema, it would be specific to yang. But this could be qi or yang. Early morning is certainly yang, right? Let's do red. Early morning means yang. Always cold means yang. Wet tongue and deep pulse mean yang. However, pale tongue and weak pulse may indicate qi. So, what I'm saying here is that we have very, very few signs and symptoms. We all can identify yang. Again, what formula would you use for this patient? Would you use a qi tonic? Are you going to use Baiju? Are you going to use Baiju? You are, aren't you? Right? You are going to tonify qi a little bit.
As my understanding, with the patient who's not that serious, they are qi deficiency first, then the yang deficiency.
That's true.
So they're already showing on the yang deficiency they can cover it by the qi.
So this is where we do see that. So if you look at Li Zhongwan as a formula, almost all the yang tonifying formulas also do tonify qi. But the pattern here does also show that there is some qi deficiency. If you just write yang deficiency, that's probably fine. But if I was, like I said, if I was being very analytical, I would say that there is both yang and qi here. All right? And also partially because for sure you're going to use points and herbs that tonify qi in the treatment. So, you can indicate yang and qi, or just say yang deficiency with the understanding that that includes qi deficiency. But either way, you have to understand that. And then the other question is there spleen or just kidney? We all know there's kidney involvement, but is there spleen involvement as well? Yes? No? Only kidney? Only kidney? Yeah, early morning. There is no real objective spleen-only symptoms. So even the tongue is not showing a lot of dampness. It's not swollen. There's no teeth marks. There's no digestive disorder. Spleen type diarrhea would almost certainly should show some weak digestive function, which we don't have. So there's no, the edema, if it was not only of the ankles, then we could say, oh, well, there's some spleen dampness, you know, we just don't have that here. So I would say this is, yeah, mostly. I mean, really, I mean, of course, the pattern is kidney yang deficiency. That's the most appropriate Zhangfu pattern for this case. What formula? What are the formulas that we use for um, Shen Qi Wan? Ji Sheng Sheng Qi. Okay. Um, You Gui we could use, or Jingui Shenqi. We probably we want to add Buguzhi is a kind of major for this type of diarrhea. Buguzhi, which so what points would you use for this case? Stomach 36, Zusan Li. Spleen 6, which is spleen 6 is Sanyan Jiao, and bladder 21 is Wei Shu, so the stomach shu point. Bladder 23 is Shen Shu, kidney shu point. Mingmen Du 4, Moxa. So if I was, for me, I would probably look at doing something like this. Moxa on do 4, UB 23 and 25 with kidney 7 and or 3, and then on the front, Moxa on stomach 36, Ren 4, stomach 25. That's a nice, simple, straightforward, basic kidney yang deficient diarrhea condition. What? Sorry, this is ginger. Yeah, moxa you could do on ginger, or salt. That's right, or directly on the salt, or even futsa, slices of futsa if you have it. I mean, it's hard to get fresh futsa here, but if you have it, you might do. The treatment considerations. What are other treatment considerations for this case? Raise the legs to get the edema out. Good. Okay. Keep warm. Avoid cold nature foods. Eat warm, tonifying foods, right? Stay warm. Don't drink too much water, or, something of that nature. Yeah, I generally don't tell patients not to drink water. I don't tell them. I mean, you have to be a little cautious. Like just, usually it's not a problem. Even edema is not. Usually drinking water is not a problem for edema. Water flushes through. It flushes through. So, you know, kidney yang deficiency, yeah, you still want to be careful. Maybe don't drink cold water. Drink hot water. Okay. Excessive uh, exercise is always good, right? For edema. Okay. Next case. MS. Wow, we spent all morning doing the cases. All morning. Okay. MS. Signs and symptoms. Numbness of the left arm. Tingling of the limbs and around the mouth. All right, he's already been diagnosed. I mean, normally if we have this, what should a red flag be? If we didn't have this already diagnosed as MS, what should the red flag be? Numbness of the arm and tingling around the mouth and limbs. No, what should our red flag be? What is the immediate medical condition that we want to rule out? Stroke. Yeah, exactly. Absolutely. This is, it's just like if you see signs and symptoms of chest pain, right? You want to immediately rule out heart attack. Numbness and tingling down the arms, around the mouth, immediately rule out, stroke. Okay? So here, we're already given that. We don't have to worry about it. I'm just trying to get you to think like that if you see something. Dizziness and feeling of heaviness of the head and legs. Feels tired, slippery pulse, weak, slippery and weak. Tongue that is swollen with a sticky yellow coating and a stomach crack. So, what's the illness? All right, what is your illness here? Good. So in this case, this is a trick question. I know this is not what we have, but what is the TCM illness? Is not MS. MS is a medical diagnosis. What is our TCM illness that that we diagnose them with? Not B syndrome. B syndrome is painful obstruction. Wei syndrome, Weijang, which is atrophy or flaccidity, right? So atrophy syndrome is Weijang. This is a case of Weijang caused by what pattern? Okay. Weijang caused by phlegm damp and underlying spleen and stomach. What deficiency? Qi, yang. Good. The Qi deficiency. I mean, where you know it, add it in. Same thing when you say, oh, it's definitely a Qi deficiency. We'll see if you can identify what organ is Qi deficient, right? But but in terms of the signs and symptoms, numbness and tingling, heaviness of the body, feeling tired, numbness and tingling. This is what you still have to make a diagnosis. What are you treating? So if what this comes from, and I know this is a little bit of a tangent. I can look at this in two ways. When you go to the CTCM PAO Pan Canadian exam, We go to the blueprint, and we're going to find a list of the 52 diseases. The internet is always very slow, mostly because we're streaming video. So because I'm streaming video at the same time, the internet is very, very slow.
Does your meaning is the test only in this 52 common condition?
Well, that's not the point. Don't narrow yourself to these 52 common conditions. I think all of you are capable of going outside of that. And indeed, with I don't know if it's in this document or not, really what they are looking at, this is not the correct document. The point is about whether or not you understand the difference between a biomedical diagnosis and a TCM diagnosis, and that's what I'm trying to focus on. Don't think about whether or not this will or will not be included. And I've heard discussions that that they're not limiting them to 52 only, right? So the point is that you need to understand pattern differentiation. You need to also understand illness identification. The other option, if you don't say Wei syndrome, then you say numbness, right? You say numbness caused by, okay? Should be in here. There we go. Okay, so in the Pan-Canadian blueprint, we have the list of all the diseases. So the question in this case, sorry, these are still WICA, there we go, internal medicine. Is there anything else, right? It's not convulsive syndrome. We don't have, which of these conditions, which of these illnesses am I diagnosing and treating? What would I be looking up in internal medicine? We don't have numbness as a separate thing here. It's not wind stroke. Let's look in the orthopedics. There's nothing here. These are all the traumas and injuries. This is what we're supposed to be focusing on today, by the way. So if I go back to the internal medicine at least, which of these is the most appropriate? What's that? Yeah, Wei syndrome, exactly. Atrophy flaccidity includes a syndrome that is very similar to this. So that's my point with this exercise, is that we have a legal scope of practice. And within that legal scope of practice, we've been granted 2 controlled acts. One controlled act is to put a needle below the dermis and do acupuncture. The second controlled act is to give a diagnosis. And you may or may not know this, but it was a fight to get that because the other medical professions didn't want to allow us to give a diagnosis. And within this, like RMTs are not allowed to do that. You have an impression, and there's a legal difference here. But what is a TCM diagnosis? The definition of that, it is the combination of the illness and the pattern. That's a TCM diagnosis. And this is really important because this is how TCM is practiced. Whether it's okay, I have a patient with a chief complaint. I need to look up that illness. I need to be able to identify what formula category am I choosing it from. That's how the internal medicine textbooks are structured. But oh wait, maybe sorry. I think it's the ICD-11 codes. You know, when we start going forward in future of regulation, we're also looking at ICD codes. And ICD codes are structured in the exact same way that our, you know, actually this is World Health Organization. This is global diagnostic codes that our medical doctors abide by. And the ICD-11 codes include a category for traditional medicine, which includes TCM diagnosis. Okay, which means that, and if you, and I'm trying to show you, it's just very slow. Which means that, you know, part of this diagnosis, you know, this is all beta, so it's giving you all this, you know, beta here, but, you know, part of this is understanding that there's both an illness, okay? These are the disorders, so they use disorders. Our college uses the term illness, okay? Traditional medicine disorders and traditional medicine patterns. So with the disorders, we have, this would probably be under, maybe it's organ system. It's probably a liver system, maybe. You know, these are all the disorders that we normally have. Maybe it's not under this. It might take me a second to find this. Chi, blood, body fluid, brain system, maybe. Yeah, so this is probably closer here. Now we have facial paralysis, vertigo, you know, wind stroke, something like this. So at any rate, these are the disorders that have a traditional correspondence. And for our perspective, a TCM medicine practitioner says, well, we have books and records going back thousands of years identifying this disease, identifying a cause of it, TCM pattern, and then treating it with success. We have a long history of this. And so these, you know, there's a lot of overlap between the Western medical diagnosis and a TCM illness, but it's not the same thing, and we need to be able to differentiate. The TCM illness is the traditional TCM syndrome, which we have the reference in the classical text. Simple as that. As soon everything that's modern, that's, you know, starting now and moving forward, you know, in the last 100 years or so, these are all Western medicine diagnosis, right? And we can see a correspondence, but it's not the same. Anyways, sorry, I'm getting off on a tangent. So in this case, we should probably say this is Wei syndrome caused by what? You said phlegm damp with underlying spleen and stomach qi deficiency. Does anybody agree, disagree, have something different? Does anybody not know why it's phlegm damp instead of something else? Okay, everybody's in agreement then? Yeah? Yeah? What's your treatment principle? I'm just writing down what you said, which was tonify spleen and stomach and remove dampness. Does anybody have something different? Okay? Anybody have something different? Resolve, damp, and phlegm, and tonify stomach and spleen. Okay. So, want my perspective now? Okay. So one of the things that we should address, like first of all, is the difference between phlegm and dampness. Does dampness cause numbness? Usually not. Phlegm causes numbness and tingling. If you look up numbness and tingling in the textbook, usually we say it's either blood stagnation, wind, or phlegm, or some combination. One of the things that that nobody's really addressing very much, well, you're addressing what you tonify, spleen and stomach, but you're not saying where do you remove the dampness? Where do you transform phlegm and dry damp, right? Where do you resolve the damp and phlegm here? From the lung? From the channel, exactly, from the meridian. So I would probably elaborate on this diagnosis a little bit by explaining, again, the mechanism in TCM, which is that this is not just phlegm and dampness as a pattern, it's phlegm and dampness obstructing the meridian, obstructing the channel. I mean, that's, well, my guess, if I had to, well, no, it's like we can't say for sure because it's not detailed. Excuse me. Oh, sorry, yawn. It's not detailed enough. The only thing that we can see is because it says around the mouth, maybe it's stomach, but it also says the limbs, right? It says tingling of the limbs. So it's like, we can't say exactly where, but we can say that the mechanism of the phlegm obstruction is that it blocks the channel. It's obstructing the channel, and we have numbness caused by phlegm. That's only relevant because when we treat this with herbs or with acupuncture, we usually treat the channel directly rather than just internal phlegm, or with herbs, we use herbs that open the meridian, course the channel and clear phlegm obstruction from the meridian to treat numbness. Numbness, usually not. Yeah, usually it must be phlegm, right? So, I mean, normally we don't get dampness causing numbness and tingling. I don't see, that was another question I was going to ask at this point. We do have a feeling of heaviness of the head and legs though. So I think it's fine to say phlegm and damp, but, specifically, we should probably, I don't know, how would I describe the diagnosis? Weijong caused by phlegm and phlegm obstructing the channels, and spleen and stomach qi deficiency with, dampness, something like that, I might say instead. I don't think that you'll get marked off too much by that wording difference, but I would say the key point is identifying the channels as being the location of the phlegm. Is everybody comfortable with that? And then yeah. So my treatment principle, what is my primary, the primary cause of the MS here, and there's nothing else that's a red flag that I have to address first immediately, but is going to be resolve phlegm from the meridians or something like that, clear phlegm from the channels, resolve phlegm from the channels, and then tonify spleen, transform dampness, or phlegm and dampness, something like that. I think that that's pretty good. As far as I'm concerned, that addresses all the signs and symptoms, right? It addresses everything. Um, external and internal. Is this external? Well, this is internal. I mean, the manifestation is a channel. So usually when we say bajang, like internal, external, we refer to exterior pathogens. This is not an exterior pathogen, but the disease, I would say, itself is the manifestation is on the superficial channel with the numbness, but the disease is really located inside because the mechanism is the interior internal obstruction, right? Due to the phlegm. I mean, it is an internal condition. Yeah. Points? What points? What acupuncture points would you use? Stomach 36. What else? LI 15. Good and interesting. Stomach 36, you said. What else? Okay. What else? It's one very important point you're missing. Spleen 9? No, not what I had in mind. Phlegm. Fenglong. Stomach 40. Yeah. Yeah. So go ahead, give me the rest of those. Okay. Why? Sanjel 5. Okay, good. What else? So, yeah, so this is something that a lot of people may have missed. I mean, we also have around the mouth, so we may also add stomach 4 or jia qinjiang, something like this. You know, like qinjiang or jia qinjiang or, some of these, I mean, it just says around the mouth, so we don't have, but we may add some local points in that area as well. You have to pick and choose a little bit. It's not, so you use LI10, you know, some people might use LI11, instead of LI10, but, it's fine. That's important to do, I think. Yeah. Yeah. But even still, the point is that you're addressing the chief complaint. Okay. If I had to remove some of these now I can get rid of stomach 36. I can get rid of spleen 9 probably, and the reason is because this is a yuan low combination pair, Fenglong with spleen 3, right? And then I probably don't need UB21. You can keep UB20, Ren 12 you can keep. It's not, empirical. Some people might add another, instead of using this LI10, what if you use lung 5 because that also deals with phlegm. It treats phlegm in the lung. So it's also. I mean, I'm just putting it out there as a possible add-on. Herbs. What formula is appropriate here? Urchin. What formula? Oh, okay. Simiao. Simiao. Urchin tong. That. Can you spell that for me, just so I can make sure that Is it urjun? You're not saying urchin. Urju. Tong. Good. Okay. Anybody have questions? What is important for lifestyle recommend? I mean, exercise is always good, but so it's not because the onset is related to. Actually, absolutely. Because the onset is related to phlegm, we want to address that. But with MS and the manifestation, then Qigong and Tai Chi are going to be very helpful for delaying the onset. Okay. Contraindications. Well, again, because this is a good formula. Again, because we already have a diagnosis, there's nothing that there's nothing that's like really a contraindication here. No, I don't see anything. Avoid dairy, sweet foods, phlegm-causing foods, right? He's not too hot, not too cold, so, it's just, yeah. Okay? So, let's take lunch. It's 12:30, 12:35. When we come back, we're going to go, we were really supposed to, again, cover the traumatology today. So I'm not sure if you guys have been reviewing this information or not. I mean, I know that this is helpful. Again, I want to stress that like the review of the content is not the same. So at the very least, we can talk about some of the trauma, injuries, and considerations for that. So let's come back at 1:30. Give yourself a little bit of a mental rest. Get some food. Maybe get some fresh air. This kind of thing. We'll be here. We'll have people here, myself or Alex. So 1:30. It's 12:35, but 1:30, 1:35. Come back by 1:30 so that we can start at 1:35. We'll see y'all soon. Sorry? Same? No, PLAR and Pan-Canadian exams are different. I mean, they're similar, but the Pan-Canadian exam is more cases, more complex, and not open notes. But the second half of the Pan-Canadian exam, the case study part, there's two parts. There's a written exam and the case study exam for Pan-Canadian, and it's this two parts, yeah. And the second part, the case study, is very similar to the PLAR, right? So it's no, there's no open book at all in Pan-Canadian exam. No open notes at all. So yeah, that's what I'm saying. You guys have it easy, but it's similar. Yeah. Sorry, say again? Well, the Pan-Canadian exam is required for anybody who's not grandparented. So let me, and then is this currently recording then now too? Okay. Okay. I don't think I want to. As long as everybody can see fine, then I don't think that I want to. Yeah. And I will use the projection, which we'll need this adapter for. Okay. Okay. then, are we up? We're up. So, thank you, Suling. All right. Everybody with me at home here? Um, welcome back. A little bit slow as usual. And we are working on the so oh yeah, I'm also Alex, do you have that USB drive?
Yeah, I do.
No. This is on, that's on.